Just wanted to talk a little bit about how the vaccine is being distributed across the country because it's very confusing. It's very confusing for all of us, and I'm sure it's even more confusing for those of you who don't know what's going on. The vaccine has been purchased by the federal government, and then in turn, it is being distributed by the states. And because of this, we have a different distribution program in every single state, and they all have different ways of doing that, and that's making it extremely confusing for people. Right now, there's two vaccines that are in distribution. That's the Pfizer and the Moderna, and there probably will be a couple more soon. Both of these two vaccines are very, very effective. In fact, they're about 95% effective, which is really much higher than most vaccines. Most vaccines are only about 60 to 70% effective. So 95% is really amazing. Again, there's other vaccines that may become available soon. The Johnson & Johnson is currently being assessed for emergency authorization and hopefully will be available soon. And this is only a one vaccine shot. It has an efficacy of about 65%, which might sound a lot lower because the Pfizer and Moderna are so high, but this is actually a pretty normal effectiveness for a vaccine. So it's really believed that it's going to be okay. And again, the more people that become vaccinated, the better. So there's a lot of hope in that vaccine as well. And it only takes one shot, so it will be much easier to distribute than the two that we have currently. When you do sign up for the vaccine, you will probably need to provide insurance information if you have it, because they are charging the administration fee. So that's the fee is assessed when you get the shot itself to your insurance. If you don't have insurance, it's okay. The states are taking care of that. But if you do, it's important for you to provide it at the time when you sign up. And each state department of health has their own distribution schedule and way of doing things. And so even within the same state, you might find differences between different counties or different cities. So even if you live in New York, for example, if you live in New York City and you have a relative that lives upstate New York, you might have completely different ways of getting the vaccine. So just be patient, and I'm going to give you some help at the end to show you how you might find some information on that. The vaccine distributions are changing all the time, so you just need to ask lots of questions, and I will give you some ideas on how to find that on the web so that you know what's going on.